cater for our own basic needs. It's not difficult. Let us all put $1 into this. $1, how many people from this community we have in America and other places? Let us all just contribute $1 and see. We can make difference in someone's life who doesn't have the chance to be seen by a doctor, who doesn't have the ability, the chances of getting $1 to buy paracetamol for himself. So I think it's a noble gesture, and it's an open thing. Sometimes you want to ask yourself, if I put $100 or we all gather money together and give it to these people, maybe they might pocket the money. But buy what we need. Medications is what we need here. Get those medications and tell them, look, this is what we gather. Let's do this one for our people and see. I think that's very transparent. You can always help anyhow you want to help. And these are some of the things you can help your community. Before you wait until they call you, this particular person died and you send $100. Send that $100 to take care of their health needs. I think that's what is important.
Thank you very much. Your final word.
My final word is we thank God for everything. We thank the community for everything. And we thank the director of GPPA, who has been very helpful. Since we started this program, he has been with us. He is the one who provides us every time with a vehicle from their department, and his fuel, everything is done. We thank him for that. We thank Harvey, who is the one disseminating information. Even if you said you are tired, he will give you the stamina to make sure, look, let's go and do this. He's really done a very wonderful job for this community. And everybody at that, everybody who directly or indirectly help us in order to get this. Observer, GRTS, and everybody. You see, this one is from Manna. Say, look, this is my community. This is what I'm contributing. We don't give him a dime. He say, look, this is my place, and I will also do my part. This is what we want from people. We thank everybody who directly or indirectly contributed towards this.
Sorry, if I may.
Before I start with that, I just want to give you a clue of how we started this.
Thank you.
We've been thinking of this for a long time. The Jatumeh people, especially those from Jatumeh, and they are outside there. So what we thought was that, why can't we contribute to go and help the village and its surroundings? And that discussion was on all the time. Alhamdulillah, then we agreed that we have to come contribute ourselves, come and give the services that the people need. When we came the first time, we saw about 700 people with a drop of worth of almost 50,000 or even more. And the transportation that brought us is from each Jatumeh people who are here at Congo and abroad, who facilitated all those drugs. From that time on, then that gives us more energy to continue treating the people of Nyani. And our aim is twofold. One, to help the people. Two, to try and see how best we can be able to facilitate to have a hospital here, a health center here. The government cannot do all. The government are doing their best, in all these places. So we Gambians should try and help supplement what they are doing. That's all we're doing. We're trying to also give our own quota by helping our people, by helping people anywhere, whoever comes here. You can see that people came from Basse to this place, all over the place. So this is what is happening. So there was a time some people came from Kau to this place. And I want to tell you that that individual got a pressure of about 180 over 115 or so. Cannot even walk. When he came here, we treated that individual. Alhamdulillah, he knows his problem and we advised him. So these are such things which we as a Gambian should contribute to be able to take this country forward. It's everybody's problem. It's not one individual, it's not the government's problem. Only the government, it's all of us. I want to thank the Divisional Health Team for allowing us to come and do this here. I want to thank even the people who work at Bansang at the eye unit. They are responsible of this place, because I've seen a lot of people who needs eye operation, who needs eye medication continually, because there are some conditions. It's not only once that you use drugs. You have to use it for the rest of your life, like glaucoma patients. In glaucoma patients, I think I have seen, my statistics not here, but I can remember well, I have seen about 20 of them who have glaucoma, suspected glaucoma. So I advise them that they have to use the drug for life, or they have to be operated. And if that condition only, whatever it destroyed, you cannot do anything about it. I don't know whether you understand. If it destroyed, because it destroyed the nerves, nobody can make the nerves to be okay like any other tissues. So if the nerve is damaged, then that's it. So he's lucky that she came, otherwise she's gonna get blind from that condition. We saw also cataract patients, pterygium patients, we saw conjunctivitis. Those can be treated and they go, there's no problem. But the cataract patients, who are more than any other patient I saw here, most of them, about 90% of the cataract that I saw, need operation. So all in total, it's about 74 patients, which I have seen. Yeah.
Still now coming, into this noble, associations that's people, that you will have in Nyani here.
Yes.
To me, we are commending the government's efforts.
Yes.
In their quest, to achieve quality health service deliveries in the country.
Yes.
But basically, still now, some person having complaining bitterly about the access to health.
Yes.
Some told me that it's like one of their pregnant woman delivered during the time of going to the health center. That's in Kenya.
Yes.
But Gambians, as Gambians, what can we do to ensure that we participate immensely towards achieving our MDGs, that is on the health?
Let me tell you one thing. It is not easy. It's not difficult, rather, to bring this, the health sector up. Although the Minister of the Health is really doing his best to bring the health center to where it is. In fact, it's one of the best in West Africa. But there's need more. If one person can put even $5 to the health sector, imagine 1.5 million times 5. It's how much? $5 is not difficult. This is what NGOs do in other countries. They go to these European countries, put a box, or say, okay, we want everybody, all of us to help, even if it is $1, $1 or £1. They all put it in the box. Imagine how many people will put $1, if it is 20 million, $20 million, $1. You understand what I'm talking about? So I think such things should be also be emulated by the Gambians. School children even contribute $1. 1.5 million here. 1.5 million times $1, see? It's 1.5 million. That's it. And 1.5 million, imagine 1.5 million, what can you do to the health sector? Now, that's too much. But let's come to our own, this little venture that we're going to do, which we are doing. People from Jatumeh, Koto here, most of them are educated, the young ones. Some are in America, Germany, wherever. Some are even working in the provinces, in Banjul, everywhere. And if each and every one of them puts $5 to go into the health of this area, I'm not talking about Jatumeh only, I'm talking about the whole of Nyani. How much would that? He said, if everybody emulates this type of strategy, you see, if you put even $1 in something, and you see someone, okay, because he has, let's say he was sick, and you put even $1 for drug, internally you feel a satisfaction in you, and at least you've done a lot for your country. Just $1, it means you have done a lot for your country, and you feel that at least I have done something for myself. These are some of the things that people need to do. I mean, we know everything's are hard, but I mean, $2, $3 for maybe 1,000 people to contribute. Even if it is $3 each for 1,000, it's how much? $3,000. If you can buy drugs and treat perhaps maybe 20 people. So this is it. Thanks.